Hi, everyone. Welcome. Hospice Nurse Julie here. That's me whenever I talk another person. Yeah. Anyway, I'm Julie. I'm coming to you live on YouTube every Tuesday at 6 p.m. Pacific Standard Time, 9 p.m. Eastern Standard Time. So all of you East Coasters, it's late out there. If I'm looking down, it's because I'm looking at your chat rooms. I'm looking up, I'm looking at the camera and trying to answer your questions. So let me know where you're coming in from and get your questions in early. I'll be here for a good 45 minutes or so and we'll talk. So welcome, everybody. Let me know where you're coming in from, your name, if you can hear me, any questions you might have. Come on in. Oh, I see some people coming in from Virginia. Peggy, Carol from North Carolina. Welcome, guys. Hey, Alyssa. Illinois. There's 2 Chicago, Illinois. Tennessee. Minnie says, hey, y'all. I love it. Hello from Texas. Last stage of dementia. Tina, that's a tough one. So I don't really see people on hospice until the very, very end stage of dementia. People are usually fully bedbound, not talking, sleeping most of the day, need to be fed, start having swallowing issues. That's the very last stage. Welcome, everybody. Come on in. What are the top 5 skills you think a palliative care nurse needs? Very good question. No one has ever asked me that. Great question. Communication skills. They need to know how to connect, read the room, and communicate effectively. So communication skills, compassion, empathy, knowledge, a lot of knowledge about specific diseases, different treatments for them. Just you need a lot of skills. I feel like you need to be a nurse for a while to be a palliative care nurse because you kind of need to be able to have seen it all. I don't know if I named 5, but I feel like the 2 main things would be communication skills, ability to read the room and understand what's happening, ability to connect with people, and then nursing skills. Galway girl, ask away. Hi, Julie. Can you tell me how long I have to live with our heart medication? Oh boy, no, I cannot tell you that. I cannot tell you how long you have to live just from the little bit of information you told me, unfortunately. In general, the further you are out from death, the harder it will be for someone to say how long you have to live. I could tell how long someone has to live if they are on hospice, have a terminal illness, or are actively dying. Then it's a little more clear. You can say they probably have 3 or 4 more days to live, or 5 or 6 more days to live. But other than that, it can be difficult. Thank you, Levies. Come on in, you guys. Hi, Megan. Thank you so much. Megan's one of my subscribers. She's so awesome. Thank you for supporting me. What is a good hospice nurse ratio to patient? Are there most important questions you should ask about staffing? Susan, great question. So most hospices should provide a nurse case manager with a caseload, meaning a patient, one nurse should have about 12 to 15 patients in her caseload. No more. They can have less. If they have less than 12, perfect. But no more between 12 and 15 patients in their caseload. That is something you should ask during the admission process when you are being evaluated for hospice. You do not have to go with the first hospice you get. You can say, you know what, I don't want to sign up today. I want to talk to other hospices. They will most likely act like, oh, well, then we can't come back if you don't sign up today, which is true. They can't. You have to get another doctor's referral. So it will take some more legwork on your end. So you'll have to get another doctor's referral to get them to come back to do a second evaluation. But if you're willing to do the work, you can definitely do that. Okay. Hello from Chesapeake, Southern Maryland. I used to get hospice care. They sure can. Anyone can get hospice care. Can a mini stroke at age 86 cause one to lose all cognitive and memory? I wouldn't say it would be a mini stroke if that was the case. Unfortunately, Galway girl, I wish I could give you more of a detailed thing, but that's just something that's so complicated. I'd have to know what part it happened in. I'd have to know how many is mini. If you can, I would talk to the doctors working with this person who had the mini stroke. I guess I could say anything's possible. That could be true, but I would ask them because we have to know a lot more information than just that, unfortunately. I think it's like Grace Foster. I'm saying it wrong for sure. But I have congestive heart failure with 2 stents in. So people with congestive heart failure can live for a very long time. It just depends. You have to take care of yourself though and go to your doctors. My mom is thinking about palliative care for colon and liver cancer. Have you got the number 1 or number 2 ideas on how to make her comfortable? So colon and liver, if she may, so this is complicated. In general, just let her listen to her body. If she's already been having pain, I would say pain medicine will help. If she's not having pain, then don't worry about it. Making sure her bowels keep moving because you don't want her to get constipated. Having her liver involved could cause some confusion, some issues, some ascites where she might need drained. So putting a drain in prior to her going on to hospice, not palliative care, but if she does end up going on hospice, that could be something. But in general, she's probably too far out to be talking about that, I bet. But I would talk to her doctors about that, the people who are working with her case and I would definitely do palliative care if you can. There's no downside to palliative care. You definitely should do it. If you're in the United States, I don't know if you're in the US or not, but if you're in the US, there's literally no downside for her doing palliative care. She should do it just to get the extra help. Have you ever seen patients who have been perfectly fine a few weeks before, then suddenly go bad, dying within a week? Yes, levies all the time, kind of. I see that all the time. Are you seeing my post? KJMCMH. Yes, I am seeing your post. Thank you. I didn't see any of the other posts though. All I see now, KJ, is something about coughing up blood, end stage, and advance. Oh, you guys, I'm so sorry. Listen to everybody. So one, I'm so glad you're all here. I'm so glad you're all here. When it comes to stuff like this, like coughing up liquid, advanced stage, like what's to be expected. So, one, it's so hard because everyone is different. And if there are active issues, which I don't know if there are or not, but if there are active issues happening in your loved one's life right now, you need to get help from someone who's not on the internet, because you have to remember, I'm speaking to you generally. You cannot, not you specific, honey, whoever, I'm not talking to one comment specifically. I'm talking to everybody now. I can only speak in general with things, right? I cannot speak to specific things because one, it would be unethical. I don't know enough about the current situation with your loved one specifically to make real judgments, and it would be unethical of me to do so. So I can give general information about things, but I cannot speak specifically to like how long your loved one has, they're experiencing this, and this. What does that mean? Are they dying soon? I can't do that, unfortunately. Not because I secretly know and I just don't want to tell you. It's like, no, I wouldn't be able to tell you unless I actually saw it and was there. So it's really hard for me to answer some of those questions. Does Medicare pay for hospice? Yes. My 82-year-old mom recently diagnosed with left lung cancer, non-alcoholic or drug use, non-operative. What should the treatment plan be? Oh, Loretta, you have to talk to doctors for that. You have to talk to your doctor. I cannot give a treatment plan for that. It would be unethical of me as a nurse online to give a treatment plan for something like that. But I really appreciate you being here, and I hope my videos can help a little bit. Is it true that hospice knows when to give the shot to help people pass easily? Joan, I hope you're still here. No, that's absolutely false. Couldn't be more false. I have CHF, exercise, small lifestyle changes. My EF is Went from 19 to 53. Ooh, that's amazing, Galway girl. That's really amazing. Okay, as a new CNA working in assisted living, how do you deal with attachments not getting too emotionally close to patients before they pass, if that makes sense? Carmen, it's going to be really hard for you because you're going to be there day in and day out, really being personal with these people. I guess the way I look at it is I fully understand that we're all going to die. All of us, me, you, all of your patients, everyone, every one of us is going to die. So I guess I look at it as like the inevitable. I know that's going to happen. And I don't think death is the worst possible thing. I think suffering is worse, right? So if I can help someone be clean, be peaceful, be okay at the end of their life, I can feel good about that. It doesn't make me sad because I already know and expect people to die, if that makes sense. And I will say I do have really good work-life boundaries. I do have to keep some boundaries. I do have to not pick up extra shifts. I do have to on my day off, not answer calls from work, stuff like that. But it's going to be hard because you're going to be really in there day in and day out. Sorry, I'm trying not to yawn. I get treated at Walter Reed. Can hospice treatment on a military base? That's a great question. I don't know. They might have their own hospice team. You should ask. Have you seen patients walking fine, then suddenly in the hospital can't even walk or get out of bed? Yes. Yes, I have seen that. Is that one of the signs of end of life? No, that's not one of the signs of end of life. It's just muscle weakening, and you can lose muscles very quickly. Very quickly. My niece has terminal brain cancer, 6 years, last 2 years on hospice. These are not good years. How long can this go on? If your niece is young, they can go on for a very long time. Fortunately or unfortunately, I don't know. It's hard. It's hard. Okay, so Paul Mann says, hi, Julie. I'm a 54-year-old, completely full stage 4 prostate cancer. I'm single with no family near that would be taking care of me. I'm not happy about dying, but nothing anyone can do. When the time comes for hospice, how often will someone come check on me? How long do they stay? Okay, so Paul, unfortunately, listen, you are going to have to provide that day-to-day care on your own. Hospice will not give you someone to be there with you 24/7, and you will need that. You will need that. So my suggestion for you, if you have money, I know this is awkward and online, but this is the truth. If you have money, any extra money, if you have some kind of assets somewhere, something, you need to use that money to have live-in caregivers to be with you 24/7, really. Maybe not right now, but eventually. If you don't have that, you need to start looking now to be placed somewhere, because hospice will eventually make you do that. They can't allow you to be there alone, and Medicare does not provide someone to be with you 24/7. Now, you might live in a state where they have a hospice home. You could do that. But I would start, if you're not on hospice yet, but thinking about it, or maybe you're on hospice, you need to start talking to them to plan stuff, because hospice is not the answer for the day-to-day stuff. Hospice will only come to your house maybe twice a week for a half hour at a time. So they're only there to manage your symptoms. They're not there to care for you, keep you clean, get you food, get you up, do all the things. They aren't there to do that. So if you have money, I would use that money to have someone. If you don't have money, then I would start planning on going somewhere. Thank you so much for asking. Thank you, KJ. Someone just said, Carmen, I love your question. Carmen, did I answer your question? Oh, yes, I did. Good. Good. My 92-year-old mom has dementia, and sometimes she leans when sitting or walking. I always go through the list of possible stroke signs. Is leaning part of the progression? So usually when someone starts leaning, that means they're losing their trunk muscle, like the muscle to hold you upright. So when that starts happening, it's because they're losing that muscle to hold them up. Now, still something to always get checked out if you're concerned, or if they're on hospice, you can ask them about it. But I would say that's a normal part of progression. But still, if you really start becoming concerned, I would definitely talk to somebody. Julie, you're the best. Thanks, NH. Do you have advice for working with family members who are very mad, upset about their loved one's situation and express their anger your way? How do you handle this sensitively? So I usually, if it's not bad, if it's not very bad and they're kind of just irritated or whatever, I don't take it personal, and I realize people grieve differently. If it is really bad and they become inappropriate and actually like offensive or are just like something I would never put, I'm not going to put up with the verbal abuse or something, then I would say, hey, listen, I realize how stressed you must be, how scary this must be. I know there's a lot going on, but you cannot talk to me like that. If there is more you need to say, like I would just sort of nib it in the butt, so you can't talk to me like that. I won't allow it. Usually if I say that, they start crying and they'll be like, I'm sorry, I'm just so, you know what I mean? So if it's bad, and then sometimes they don't too, and they get more mad and they kick you out, and like, that's their way of dealing with it. Right. Or sometimes if someone's not being angry, but they're being anxious, and they're being anxious and kind of irritated and kind of like, I'll say, hey, I just want to let you know that I think you're doing a really good job. You're doing a really good job. I know how hard this is. Usually that takes people's guards down and they're like, oh, and they start, and then they warm up to a bit. So those are my two suggestions. But if it is really, really bad and you feel like you're being like verbally abused, you just need to nip that in the bud right away, because you can't be. I thought hospice provided delivery of prescriptions, but the company we use would not deliver, and I would take my mom. Oh my gosh, no. Hospice companies should deliver the medications. That's like a Medicare guideline. They should be. You are correct. My husband is 40 and he's dying. I've had negative experiences with the death and dying of my loved ones, so all that added to my fear and anxiety. Oh, just here for the videos. I'm so sorry. I can only imagine. And dying from something at 40 is I mean, there's just so many tough things from that. Usually a disease that's pretty tough. Dying young is pretty tough. And then you being the caregiver is very tough. I'm so sorry. I don't know if you're, I think you said husband. I don't know if he's on hospice yet or not. Either way, it's really tough. I hope this community here can help you. I hope my lives can help you. I hope my videos help you in some way. And you're right. It's really tough. Julie, what still surprises you in your work? I'm a newbie and everything feels surprising. I'm curious when it will all start feeling normal. Allison, you know what, Allison? I hope this doesn't make you like, oh man, but I would say like around 2 years. 2 years. Now, I don't know if you're a new nurse or you're a new hospice nurse. So if you're a new nurse, it took like 5 years for things not to be surprising as a new nurse. As a new hospice nurse, it took 2 years. And does anything still surprise me? Not really. Sometimes people's humor will surprise me, but I don't get surprised much at work. No. I don't know if that's a good or a bad thing. Hey, Kimberly, thank you. What do you think happens after we die? Personally, now this is not me trying to make anyone believe anything. Truly, I'm just telling you what I personally believe. This is not a part of the chat where you guys tell me I'm wrong and I'm going to hell. So back off. No, I'm just kidding. And you guys don't have to believe what I believe. I personally believe that we are all going to somewhere very good that's going to feel more like home than here will ever feel. So I feel like, I know it feels so scary and like what's going to happen, yada, yada. I just feel like once we're there, it's going to be like, how did I ever forget this place? How did I ever forget this place and all the people in it? That's what I think it's going to feel like. My mother was in a coma-like state, but when I talked to her, I could tell she could hear me. I could see a tear come down her eye as if to let me know she was there. Last moment, she looked at me. Wow. I'm glad you're here, Denise. Thank you. Oh, thank you, Dana. 94-year-old mom has under 3.7 hemoglobin. Okay. Okay, days, but more bad than good. Do you think it's possible that she old eat and will still wait till the end? She's on hospice. Sue, I'm so sorry. I don't know what the question is. Can you rewrite that? I can't. Can you rewrite that? I think if she's, I'll just say this: she's 94. She's already on hospice. Just think of it this way: someone who's 94 is end of their life ish, no matter what. Even if they're the healthiest 94-year-old, you're still end of your life ish, right? So go with how she is day by day. Some days are good, some days are bad. Don't force anything. Don't force her to eat. Let her eat if she wants it. Let her sleep if she wants it. And that's it. If she's comfortable, good. And just let her be. And take each day as it comes. There's no answers, unfortunately, right? People, I love answers. I love knowing. I love certainty. I love black and whiteness. This is this. This is this. This is when it's going to happen. This is how long, right? And it's just not like that. It's just not like that, unfortunately. So I would just say go by how she looks day in, day out. Let her sleep if she wants to sleep. Let her eat if she wants to eat. If she never wants to eat or drink, don't make her. If she always wants to sleep, as long as she's clean and comfortable, go for it, right? And her body will let us know what's going on. So I would just thank you, Megan, for deleting comments if they're not nice. Just here for the videos. Thank you. Thank you so much. Thank you so much. Tim, thank you for being here. He's not on hospital yet, but he has terminal cancer. I've learned so much. Oh, thank you. Okay. Dear Dana, I hope you're still here. Both my mom's parents started getting dementia around 80 years old. My mom is 81. She's a young 81. I love that. She's been on Klonopin for 30 years. Easy. Can you give me any feedback? Girl, if it's working for her, more power to her. If she's on Klonopin for 30 years, you should not. That's it. There's nothing to do about it. I can't say anything. I'm not her doctor, right? I can't give medical advice. Thank you, Lisa Jane. But if it's been 30 years and it's still working for her and there's no issues right now, I would just keep doing what we're doing. But I would obviously talk to her doctor and see what they say. But I don't know. If some doctor's trying to get her off medication now, it's like she's 81, she's young, she's doing well, it's like, I don't know. Why mess with something that's working, you know? That's my 2 cents, girl, but you truly have to talk to. I can't give, like, medical advice about it, if that makes sense. Okay, let's see here. Hi, Julie. Do not worry about blood sugar control. Do you worry about blood sugar control towards the end and checking blood sugar, seeing if patients crashing or not crashing? So it's going to depend on the nurse and doctor you're working with and what's going on with that patient specifically. If they're a diabetic type 1, yes, we still want to look at that because they've been a diabetic their whole entire life and they basically need to do that. If they're type 2 diabetes, usually that kind of clears up on its own because they've lost a bunch of weight anyway and they don't really, and sugars aren't that big of an issue. But if they've had their pancreas out because of pancreatic cancer or something crazy, then maybe we do. So it really just depends. For a general statement, we don't fully watch or care about blood sugars generally unless there's very specific reasons as to why we should. Hope that helps. Hope that helps. Thank you, Galway girl. And thank you, Lisa Jane. I don't know if you asked me a question or if you're just giving me some love and giving me some money. I appreciate it. Thanks, Freebird. I have never heard of ICU brain either. I've heard of ICU psychosis. Sometimes people in the ICU they can get a little goofy. And because their nights and days get screwed up and they can get a little loopy. And then eventually once they get out of the ICU, they kind of start coming back around, but it can take a while. Denise, I'm so glad that you believe something different than me, and I believe something different than you. And I will listen to that song, but I have a feeling my belief won't change. Oh, Lisa Jane, so you did ask me a question. I'm so sorry, sweetie. I can't really help with that. So she says, my 91-year-old dad just got rushed to the by an ambulance for COVID pneumonia last night. He's on O2 getting the medication for COVID. What are his chances? Otherwise healthy? Yes, it's so hard to know. Lisa Jane, you need to go to the hospital if you're not there already and ask them. Ask them. If they can't give you a straight answer, it's because there isn't a straight answer yet. Sometimes with COVID specifically, you need to give time. You need to give time. But I would listen to what your dad has said as well. If they don't, he has a health directive, no heroics, right? If he says he doesn't want to be intubated, doesn't want chest compressions, all those things, you have to respect that. But in general, talk to the doctors that are working with him, okay? Would radiation to control the growth of a fungating breast cancer disqualify one from hospice? It's just to control the growth, smell, distress. Susan, sometimes yes, sometimes no. A lot of times if it's just radiation for comfort and stuff, then no. So I would check with the hospice to see first, because technically Medicare is allowing radiation for things like that when it's just for comfort and palliative measures. So you might be able to. Yes. Denise wrote much love. Thank you, Denise. See, I appreciate that. Much love to you too. For real. For real. My wife had a spot on her lung, was gone a couple weeks later before the next appointment. Rapid breathing that night. I think she was hiding it from me to save my worry. Oh, so did it end up going away, huh? So if Eric just asked, what's the difference between hospice and palliative care? Eric, there is only because only to save time, there is a video on my YouTube page. So if you guys don't subscribe to me, I'm Hospice Nurse Julie on YouTube. Please subscribe. It's free to subscribe. There is a membership, which does cost money, but you do not have to do that. You can if you want, but also just to subscribe to my channel, you get like notifications when I post videos. And there is a video called What's the Difference Between Hospice and Palliative Care? So you can go watch that video. It's like 8 minutes long. It'll describe it all for you. It will describe it all for you. If I haven't answered your question yet, please continue to ask it. You can also ask it in all caps. That'll be easier for me to see as well. Hi, Patrick. Do you try to stay detached from patients to save your heartache? So for the past several years, I've worked per diem, which means I do mostly admission work because I don't work as a full-time case manager. So that does help because I don't see patients over and over and over again until they die. However, I have been that kind of hospice nurse. And I would say it's a little more heart achy, but still not that much, because I believe so much in hospice and dying well. And I feel like hospice helps you die well. So although people are dying around me, it's inevitable. Everyone's going to die. So now that I know that, I'm so proud to work for something that helps people die in home peacefully. Because I've seen the other thing. I've seen the other way in the hospital, tubes, hanging on, doing everything possible, no one talking about anything, suffering. And I don't want that for people. And death is inevitable. So that's a long-winded. Even if I am attached, I'm still not super sad they die, because to me, death is not the worst possible thing. Oh, Denise, thank you. Thank you. And thank you for your kindness towards others. I appreciate you. Julie, my friend, has GBM. She's very last stages, can't move. The short time she's awake, she talks but seems loopy. Does she know what she's saying? So it's so hard to know. GBM, glioblastoma is the other name for it, is really difficult. Really, really difficult. People are usually pretty young. And sometimes depending on where the tumor is in the brain, it's like they're speaking, but they can't really get out the words they want to get out, or you're saying something to them and they can't cognitively understand. So it's just hard. It's just hard. That's it. Like, I hate that that's like, sometimes with diseases like that, people are just like medicated until the end because it's hard. It's hard to be awake and not be able to communicate. It's hard to be awake if you're anxious, right? So it's just hard. I wish I had something easier to say to you. That's a really, really difficult one. And those are the times when I do get upset at my job, when I feel like we can't control someone's symptoms. But a lot of times we totally can control someone's symptoms, but it just means that we have to basically make them unconscious. Now, again, I'm not saying that with your friend. I have no idea. But I mean, I feel like glioblastoma or GBM is one of those ones that can be like that, where it's like they're awake and kind of uncomfortable, or asleep and not. But I will say, if she's awake and talking to you, even though she's loopy, but she feels okay, just go with it. Just go with it. If she doesn't seem stressed out by it, just go with whatever's going on. And by the way, my foot is moving this chair. This chair is not moving on its own, although it does look like that. What's the average amount of time someone spends on a hospice? I want to say 72 days is the average, which is probably longer than people think. Thanks, Kathy Ann. What is considered shallow breathing? Days before death, would breathing be shallow or rapid? So much to learn. Sue, it depends on the person, shallow or rapid, sometimes both. Sometimes rapid and shallow, sometimes deep and slow. My brain is so perverted. You guys, my brain is so perverted. I almost said that's what she said, and it's not funny. Who watches The Office? Anyway, my whole point is sometimes it's all types of ways. End of life breathing can be all types of ways. I'm sorry, I just made a perverted joke out of that. Hopefully some people here will think it's funny. I think some people will not find it funny, and they'll think I'm obnoxious, and I apologize. I apologize. Thank you, Lisa. Thank you, Stacy. Okay, good. Some people are laughing. I'm just waiting for people to be like, you are so offensive. Can you share with me at the end of GBM, which is glioblastoma, within a few days of passing, what are the symptoms? Thank you. Okay, so usually with GBM, the end of life symptoms are just once it's very, very end, last few days. They look almost just like everyone else would look, which is fully unconscious. So not awake at all, ever. Fully unconscious. No eating and drinking at all. Then they will have changes in breathing. They'll breathe differently, very normal. Their eyes might be open, their mouths might be hanging open. You might hear some gurgling noises, terminal secretions, changes in skin color, changes in temperature. Now with GBM, sometimes they will have little jerking motions or little seizures, depending, or big seizures. Not always though. I'm just trying to kind of paint you like basically like worst case scenario would be a big long seizure. That rarely ever happens, but it can. So seizures is the one thing with GBM that can happen at the end of life that it doesn't always happen with everybody else. But for the most part, they're going to look like almost everybody else. Sometimes there'll be some terminal agitation, meaning like wanting to get up, or like moving around. Sometimes there's like crying and stuff too, just because the brain is, there's like tumors and stuff. So they don't have like emotional regulation sometimes. Again, not always. But at the very, very end, usually it's the most peaceful time because for a long time they've been having all of these symptoms because they're still kind of awake. The very, very end, they're not really like that. So it might be even less symptoms. Hope that helps. Tim Smith. I'm sorry. Hold on. Let me say. It's okay to be silly. Yes. Thank you, guys. Aw, I love it. Okay. Back to questions. Thank you so much, you guys. And thanks for being so funny with me. If you guys don't know what I'm talking about, you'll have to rewatch it. You'll see what I mean once you see it. Oh, wow, Freebird. That's great. Okay, patients that hold on for days or weeks or so during the transitional period. What is the most effective communication to say why that's happening to family members? Okay, so that's great. So a lot of times family members, and I get it, when someone's hanging on for so long, they're not eating and drinking, they're mostly unconscious, but they will live sometimes that way for days. I've seen 3 weeks someone do that. It's very rare, but still. Or someone who's just almost in the actively dying phase, but not quite, and they hang on for so long. Families like, when? What's happening? What do we have to say? Are they waiting for someone? Do I need to say we'll be okay? Should I touch them? Should I not? Should we leave them alone? Should it's just hard to be around that. The main thing I say is this, what I just said to you. I just say it's so hard to live in this unknown area, right? I know I love living in certainty. They're going to die Thursday, right? I don't say that, but like living in certainty feels safe. Living in uncertainty, not knowing how long is this going on, that can feel so uncomfortable. And the only thing I can say to you is that I know it feels uncomfortable. I can't express to you how much your loved one is showing me that they are not uncomfortable, that they are not suffering in this moment. And this is not an emergency. And if you can just try your hardest to be here now, be in this moment with them. Because I think when you look back, you won't regret that you were able to do that. So you can say all the things you need to say. You can come and go as you please. And it may matter and it may not. But in general, what you'll remember the most, I think, is if you're able to be present in this moment with your loved one, despite how uncomfortable it may be for you, because watching them go through this. It's one of the greatest gifts you can give yourself and your loved one dying. And just to help them kind of, and if their brain is spinning, I always say, if your brain's spinning, did I do enough? Did I do this? You're focusing on all these different things. I say, remind yourself, are they clean? Yes. Are they safe? Yes. Are they comfortable? Yes. If those 3 answers are yeses, you're good, and try to just be present with this person. It's a very long-winded thing, but that's kind of the way I go about it. Hey, Bay Area Ghost. How's it going? Nice to see you. Nice to see you again. Thank you for the $10. It's so funny how YouTube makes it like $9.99. That's hilarious. Instead of a solid 10. I crave certainty. I was trained as an engineer, so I look at everything black and white. I get it. I crave certainty too, and I feel like I live this day in and day out, and I try not to live like that because I know it can be a struggle. Anything you can do with hospice without a degree? Yeah, well, one, you can volunteer if you have the time. You can volunteer without a degree. You could probably work in administration. I don't know how nice that would be though, but you probably could work in administration. You could also become a death doula, which they don't really work with hospice, but they work with death and dying, which is great. In the states where it's legal, can you have a registered sex worker in hospice? Gray area ghost. I've never been asked that question. In the states where it's legal, can you have a registered sex worker in hospice? That's a great question. I have no idea. I would say I bet they don't. I bet the answer is no. But hey, if it's legal, here's the thing. If it's legal and a patient wants it and are willing to pay for it, they can do whatever the frick they want. We can't stop them. Just like it's legal, weed's legal here. They can buy weed and smoke weed and do whatever they want with weed. So maybe that's the same with sex working. I don't know. Oh, Lisa, yeah. I have a video of my 91-year-old grandfather's passing while on palliative care, very peaceful, and I don't get upset when I watch it. This is a reference to one of your videos of someone actively dying. Thank you. Both my grandparents died 10 years early from cigarettes. Do you see this a lot? I do see a lot of people who have drinking and smoking in their histories like extensively, and they do die from that for sure. Oh, thanks, Freebird. Will Medicare pay for it? Medicare will not pay for the sex worker. No, because I'll tell you why too. Because Medicare is federally funded, right? So Medicare pays for hospice because that's a federally funded program, but Medicare will not pay for something that's not federally acknowledged. So things like weed, they won't pay for it because it's not federally acknowledged on hospice. Sex workers, they won't pay for it because it's not federally acknowledged, right, as a law federally. And they won't pay for like the end of life medication. So people who need that end of life medication, if they have a state that provides it, Medicare will not pay for that. You have to pay, you have to come off hospice, pay for it with your insurance or pay out of pocket, and then come back on because it's not federally funded. Does that make sense? Thank you, Kimberly. Thanks everyone who's like gassing me up. I really appreciate it. Do you think a person who knows their death is near, for example, myself, for the past 3 months, I've been feeling my body change and feelings that my death is near, even though I am productive? So, Tiffany, I don't know specifically about you. So, I don't want to speak to you specifically, but I will say in people who are on hospice, who are like for sure dying soon because they have a terminal illness, and unless a miracle happens, which I believe in miracles, but unless that happens, they will die from this disease probably in a few months. I will say they do seem to know because there'll be family members. Sometimes families will be like, "Don't tell so and so that they have da 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 da." They, we don't want them to know. And then I'll talk to them for a little bit, kind of catch the vibe of the room, and then I'll ask them, "Do you have any questions? Do you know what's going on? Like, what are you feeling?" And 9 out of 10 times they go, "I feel like I'm dying. I can tell." So I do think people know. Now, I don't know about if someone is like perfectly healthy and they just feel like they're dying. I have no idea. That's probably a different thing. But I do think when we live in our bodies, Barbara Carnes always says, we live in our bodies. We know when we're dying. So I do think people do. Hey, Sherry, Riley, nice to see you. Hi, Julie. Late getting here. Virginia here. Oh, it's going on 10 p.m. No wonder. Yeah, it's bedtime for you. It is for me anyway, 10 p.m. You've helped me so much since my dad died on hospice back in August. Dad had cirrhosis, had a tube also. Yes. Well, thank you for being here, even though it's so late. And thank you for being there for your dad. Thank you for being there for your dad. James. Okay, back to the sex worker thing. Poor people who are joining this live late. So the sex worker would be the sex worker, and the person would pay to have the things done. They wouldn't work for hospice. They would just work for the patient, but the patient had to pay for it, if you know what I mean. So I don't know if you guys know Hospice Nurse Penny, but we're buddies, we're friends. And Hospice Nurse Penny used to work in a hospice facility, like a hospice home, where patients were in this home where she worked. And she walked in on a husband and wife doing the thing, doing the dirty. So just saying. But I don't think they were like doing it. They were just like playing around, if you know what I mean. I'm trying to think of anyone. The topic of sex doesn't actually come up much for me anyway. Hi, Julie. Is it true morphine does not encourage death sooner? Tess. Yes, Tess. I'm so glad you said that, because usually it says, is it true that morphine does hasten death, meaning bring it on quicker? But that is not true. It is true that morphine does not bring on death sooner. Now, I think people think that because people overdose on things like that all the time. When it's recreationally used, and it's usually a lot, and it's usually injected, that can cause overdoses. But that is not how we're doing it in hospice. We're giving very minuscule amounts under the tongue, very, very small amounts. So we cannot be overdosing people. It does decrease the respiratory drive, though, which is why we give it, because it actually makes people feel less air hunger. Yes, Kathy says, just wondering, when my mom was in hospice, she would be sitting in bed, started snoring with her eyes open. Can you explain? So at the end of life, Rich Cassone said there's a ghost moving the chair. And that's what I said earlier, because I said it looks like there's a ghost moving the chair, but really it's me. And then you said, you're watching too many scary movies, Rich Cassone. I wonder why. Okay, let me answer Kathy's question, and then we're going to get back to Rich. So your mom was likely doing that, one, because at the end of life, our muscles are really relaxed, and it takes muscles to shut the eye and close the eye. So when someone's getting near the end of life, those muscles really relax and weaken. So you find people sleeping with their eyes open. So their eyes look open, but like no one's home. That's very normal, but it can freak some people out. But it's very normal. Do you have any cats? Melissa, I wish I had cats. No, I don't have any cats, but someday, maybe. Rich, do you have any questions besides the ghost question, mister? Thank you, Tim. Man, the silence here is quiet. I guess I can Google it. Irene, girl, I'm sorry. I didn't see your question. If you write it again, Irene, in all caps, I might be able to see it. When I look up to talk to the camera about answering the questions, then I miss all the other questions coming in. Remember Wayne's World? Camera 1, camera 2. Camera 1, camera 2. Wasn't that Wayne's World? Have you ever witnessed families fighting when someone was dying on hospice? Yes. Families fight all the time when someone's dying on the hospice. All the time. Sometimes we can get into it and help, and sometimes it is what it is. Families are not going to just clear up and be functional just because someone's dying. You know what I mean? Jelly bean. Is fever comfortable at end of life? I would say it's hard to know. I think fever is uncomfortable, but I also think people are really unconscious at that point, so it's hard to know. I would treat fever either with a Tylenol suppository if they were easy to turn, because I think it's very easy to do that. If they're not easy to turn or they're having a lot of issues with terminal agitation or something, I would do it with just cold cloths. Cold cloths, forehead, under the neck, and the armpits, underneath the knees. Have I ever seen a ghost? Oh, no, I have not, thankfully. Oh, Irene, I see your message. How is the end of life medications given? So if you are in the US, it's given to you usually in a powder and you mix it with like 3 ounces of water, not much. You take it like a shot. If you're in Canada, I think it's given IV by a doctor. So a little different. Did anyone give you a hard time when you became a hospice nurse? My mom is an RT in peds and thinks my choice is strange. Yes, I would say I was very surprised that anyone on the internet wanted to listen to me talk about hospice or death and dying, because everyone in my life did not. So I wouldn't say I was given a hard time, but like no one wanted to talk to me about like how my day was, or wanted to hear stories about my day. Or if I was at a dinner party and said like, oh, I'm a hospice nurse, no one was like, interesting, tell me more. Everyone was like, ugh, ugh, yikes, right? So yes and no, but people mostly are like, isn't that depressing? And then you have to explain how it's not depressing. Oh, thanks, Rebecca. Boo, 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 boo. Can your pets you in hospice? So Bay Area ghosts, pets can come with you to hospice, yes, but usually you're in your home anyway. What time is it? Oh, it's almost time to go, guys. Almost time to go. Find one more question. So I come here every Tuesday at 6 p.m. Pacific Standard Time, 9 p.m. Eastern Standard Time, every Tuesday. Oh, thank you, dear Dana. Thank you so much for everyone who was here. Thank you for everyone who gave me gifts. Thank you, Megan, for moderating and people telling other people to like the lives, all the things. Thank you so much. If you don't subscribe to me already, it is free on YouTube. Hospice Nurse Julie, just hit the subscribe button and you should be able to get notifications for my videos. They come out every 2 a week. 2 long form videos a week. And then I do a live every Tuesday. All right, you guys, I'm out of here. I'll see you next Tuesday. If I didn't answer your question, come back next Tuesday and I'll see you then. Thank you so much. I'll talk to you later.